So today I'll be talking a little bit about our latest update on the COVID-19 public health response, some of the changes that are coming and will be posted in the coming days, and recognizing as well that we will be very soon at our 2-year anniversary from the very first case that we had here in British Columbia in our first press briefing on Friday. We do continue to see a gradual decline in our case rates over time and a leveling off of the test positivity. And as you know, the numbers of daily cases gives us a sense of trends using that one piece of surveillance data. But we also have other surveillance data that also supports that we are on that downward trend in community infections. But at the same time, the number of people in hospital remains high, and it's the highest it has been in our pandemic. And it's putting significant strain on our healthcare system. As our pandemic evolves and Omicron brings these new challenges, we have evolved our pandemic response, and I've talked quite a bit about that in the last 2 weeks. Last week, we made many changes that I had indicated in briefings before, but it challenges us when these things are different and new. As we shared last week, and thinking at the heat map that we presented on Friday, we do know that even now with Omicron, some people are at much greater risk of hospitalization and severe illness. And we need to bear that in mind as we make these changes. The risk factors are clear. Number one and most important, and one of the reasons why we are getting through this wave in the way that we are, is vaccination status. We know that vaccines make a difference. A tremendous difference. The other one, of course, is age. And from the very beginning, we've seen that the older we are, the higher likelihood we have of having more severe illness, and the higher likelihood we have of having other underlying conditions that may complicate an infection with something like COVID. And in particular, people who have compromised immune systems, what we've talked about as clinically extremely vulnerable, they are more at risk even with vaccination. We also know that with each vaccine that we receive, our risk of hospitalization goes down dramatically. Yes, we know that people who have been fully vaccinated have been infected with the virus, with Omicron in particular, and some may question that the effectiveness of vaccines overall. I want to assure you, and we see these data coming more and more now, it takes time to put these pieces of the puzzle together when something new and a new strain of the virus comes on the scene. We now have had another month of time since Omicron came on the scene, and we are seeing more and more pieces of this puzzle come together. And it shows us the effectiveness of vaccines and the importance of vaccines and protecting people from severe illness. And also now, of course, there's more and more data that shows that the booster doses also protect against infection, even with Omicron. We do, however, need to continue the number of measures that we have in place in the community, and those also have been working to try and mitigate those risks, even when there is risk of milder disease. So with that in mind, we will be extending the BC Vaccine Card program through to June 30th. And it will continue to apply to people over the age of 12. If we are in a better place before June 30th, however, we will look to make adjustments early. The BC Vaccine Card program is specifically designed to address those and mitigate those risks that allow us to keep certain businesses and activities open during the period of the pandemic. As we move through this period, it will, I expect, no longer be necessary. But right now, it is one of those important tools that we have. As mentioned, has been the case all along, with a sudden surge, it takes time to gather and reassess and assess the data. In recent days, there have been a number of publications, 3 studies from the US. We've looked at additional information from Ontario, from Japan, from South Korea, and it really tells us right now that those booster doses give good, strong protection against Omicron as well. It boosts up that protection for severe disease and hospitalization, but it also decreases your risk of contracting the virus, probably by about 50 to 60%. So it is not 100%. It's not as high as we saw with all of the other strains that we've seen, and particularly that really important protection against the severeness of Delta. But it is important, and it does stop your risk of transmitting to those who are closest to you and your risk of contracting it yourselves. We do know, however, that I do want to also mention that people in the clinically extremely vulnerable groups, 1 and 2, the people with compromised immune systems, and we know that we've had a 3rd dose to get them up to that level that most of us get with 2 doses, and we did announce when we announced our booster program that they would be eligible for boosters at 6 months as well. And I just want to reassure people in that category that yes, you will receive your invites for your booster dose at 6 months. And we know that people who have immune compromising conditions, and the data from Friday shows us this again, that the risk remains high, and you do need to take extra precautions, and all the rest of us need to be aware of that and take those extra precautions as well. We need to follow the public health orders so that we reduce the risk to everyone, because we all have someone in our circle, whether it's family, whether it's in our social contacts, at work, who is immune compromised, who's older, who may have that extra risk right now when there's so much of this virus still circulating. Whether we know it or not, we all have those people in our lives. That is why we must all continue to take those actions. We still have provincial health officer orders in effect. We still have things like our BC vaccine card for those highest risk activities. And we need to all take those actions that work. Our number 1 tool, not the only tool, but our number 1 tool remains immunization, vaccination with both dose 1, dose 2, and your booster dose. But it also is things like limiting the numbers that we're gathering with right now when there's so much virus in our community. Wearing masks, good quality masks when we're in indoor public settings around other people. Washing our hands regularly. Staying away from others when we're sick, particularly if we have a fever. And following those important things like our COVID safety plans that we have in our workplaces, like the plans we have in our schools, like the measures that we have in place in post-secondary institutions. This remains so, so important right now as we weather this wave of our storm. Today, the National Advisory Committee on Immunization updated their guidance around childhood vaccines, particularly for those 5 to 11. And you may recall when they first came up the language was around may be offered. Well, they have strengthened that recommendation, and that is because what we are seeing is that 5 to 11-year-olds, thankfully, remain at low risk of severe disease, but the number of children being hospitalized because of infections has gone up, as the number of infections has gone up across our communities. In addition, we have new and reassuring real-world safety data from millions and millions of young children who've been protected through vaccination. And so they have strengthened the recommendation to say that all children 5 to 11 should be vaccinated. We also want to, this guidance also recommends that there continues to be at least 8 weeks between first dose and second dose. That first dose will provide tremendous protection. It's that 80% protection once you've had your immune system has started developing those antibodies, and that will make the difference for what's happening right now. But we want to make sure that we're protecting children for the long run as well. And we know that that extended interval between doses gives our immune system a chance to respond and give extra strength to our cell-mediated immunity and boost up our antibodies as well. So it is not only to protect us for now, but also to make sure that we're giving the best priming of the immune system for the future too, as we get through this wave. I do want to assure parents who've already had their children vaccinated with their first dose that you will receive an invitation to book your second dose around the 8-week period. And sometimes it's a few days before, a few days after, but our system is working really well, and you will get that invite. As we do start to see the gradual decline in cases in our community, combined with the increase in vaccination in children of all ages, I will be making some changes to the restrictions on youth sports tournaments. Starting February 1st, next week, youth sports tournaments can once again resume. I know that this is an important time of the year for many different sports, especially team sports, and we've been working with organizers and with Via Sport to make sure that this can be done in a safe way. So that means tournament organizers, you can start planning in anticipation of this change for next week. Right now, because of what we're seeing, adult tournaments remain paused for now. Today, this week, we saw many of our post-secondary institutions going back into on-campus learning again, and I'm just really pleased and proud that that's happening. I know there's been 17 of our institutions who've started even before now. This really is so important, and we recognize that, and I just know that we've been working hard, working with all of faculty and staff and student organizations for all of our post-secondary institutions, and we know that young people have been so differentially negatively affected by this pandemic, and that these on-campus interactions and learning is so important for their growth, for their development, for the research, and all of the bright minds that we need to stimulate in our universities and colleges. And I think this is really possible because young people have stepped up and gotten vaccinated, and the high vaccination rates we have in post-secondary institutions make it safe. And we've updated in conversations and collaboration with the post-secondary institutions and the Ministry of Advanced Ed, the Safe Return to Campus Guidelines, and that includes the program for accessing rapid tests and having those to support safe back-to-campus activities. So I think that's going to be a great step forward for many, many students, faculty, and staff across the province. Additionally, we've been working with the early childhood sector, early childhood educators, and who have been in childcare operators who've been working so hard through this pandemic. And I know these changes have led to lots of questions and concerns. We have last week posted the updated guidelines for the early childhood educators and childcare sector, and we've been taking lots of questions over the last few days and working with them to answer these questions and address the concerns. And clarifications will be released with some questions and answers for people, and I know we have a town hall tomorrow night to walk through it with many of the providers. And I just want to again express my appreciation for all of the early childhood educators and our childcare programs for the stellar job that they're doing caring for our children during a very changing and challenging time. In step with the changes that we saw last week, we also shared that our long-term care and assisted living facilities have seen a sharp increase in cases, and our seniors and elders continue to bear the significant burden from this virus, and that has not changed in terms of people becoming ill. However, the high rate of immunization and the high rate of booster doses that we're seeing amongst our seniors in long-term care and amongst staff means that we are having a much, much lower rate of severe illness in long-term care homes and assisted living homes, and thankfully a much, much reduced risk of things like death. Because of this, combined with the severe impacts that come with the measures that we have had to take to try and suppress transmission in long-term care homes, we are working very closely with long-term care homes to make sure that we can continue to have designated visitors for every resident who has one, and make sure that we have those all-important visits continuing even when we have some cases of COVID-19. And public health teams are actively monitoring and engaged with facilities across the province to manage these outbreaks and balance that risk that we have and the harms that come both from from Omicron and from the measures that we put in place. Updated guidance for outbreaks, we're working on that now, and that will be posted again in the coming days, balancing that need for restrictions with the severity of illness that we see on a case-by-case basis. So I've spoken last week in some detail about the fact that with Omicron, it has changed some of the tools that we have used quite extensively over the past 2 years. In particular, with that shorter incubation period and what we call the generation time, so the time between one person getting infected or being exposed and the next person getting sick and passing it on to others, is much shorter with this new virus strain. So it is no longer viable for us to be able to rely on the contact tracing that we were doing. That was really making a difference. And it's really that recognition that by the time you develop symptoms and potentially get tested, you have likely, unknowingly, passed it on to others. Previously, with different strains, when that was 5 or 6 days before the next generation, we had time. We had time on our side and the opportunity to find people and to help them isolate before they would pass it on to others. That is far more difficult now, and why it is important for us to all go back to those basics we need to do as we are navigating our way through our days and deciding what it is safe for us to do individually for us and our children every day. We need to continue, as I've said, following those public health orders because they address some of the highest risk settings that we're faced with right now and those restrictions that are in place. But we also need to take collective actions to reduce risk every day. It's about thinking not only about our loved ones and ourselves, but those around us who we may or may not know are at higher risk. Perhaps an older relative, a colleague that we work with, or a close friend that we spend time with. Let's remember that they're sharing their risk with us and we share our risk with them. That's why those layers of protection continue to be so important. And so in addition to the continued work of public health and our teams focusing on where we need to make a difference in high-risk settings, particularly long-term care, supporting post-secondary institutions, supporting schools, supporting some of those high-risk accommodation settings. It means doing what we all have a role to do, doing what we have been doing, as I mentioned, getting vaccinated, wearing masks, washing your hands, keeping your groups small, and being extra cautious if you are at high risk. It means paying attention every day to how we are feeling, staying home if we're feeling unwell, particularly if we have a fever, staying away from others, and returning to normal activities when we feel better. We also need to be aware that we have in our workplaces COVID-19 safety plans. That's one of those things that helps us mitigate that risk for people who have mild illness that they don't recognize or may be infected asymptomatically. If we use the BC CDC symptom checker, which has now been updated, to help identify if you likely have COVID-19, and then follow the guidance on when you need to get tested. We do know that it is important to test certain people, particularly people where you might be eligible for treatment, or you may be more at risk of severe illness, or for people like healthcare workers where we need to understand when it's safe to go back to work. If you are confirmed positive, then you must follow the self-isolation requirements. If you're unvaccinated, that means 10 days for adults. If you're vaccinated, or if you're a child under the age of 18, that's 5 days. And we know that because we know that children have milder illness and we tend to have less virus and shed less virus when we're vaccinated. But it's important that we consider that risk doesn't drop off to zero after 5 days. But it does decrease quite dramatically after about 5 days in most people. So we need to, if you have mild illness and you're feeling well and your fever's resolved after 5 days, then you can go back to activities, but it's not back to everything all at once. We still need to realize that we may be shedding some virus. So it goes back to COVID safety plans at work, wearing a mask when we're around other people in indoor settings, and avoiding high-risk settings like long-term care homes if we can during that next additional 5 days. So those are the things that we can all do that will get us through what we're dealing with right now with Omicron in the next few weeks. This has been a tough go for all of us, and it has been changing. We've gone through many different iterations of how this virus has affected us over this last 2 years. And we're all tired of COVID-19, no one more than me, and the impacts that the virus has had on all factors in our life. I think we would all love to be done with COVID, but as much as we would like that, our reality is that COVID is here with us right now, and we're not yet over it. So let's offer each other that encouraging words, that warm smile, that connection, that kindness. Remember that this is ever-changing, and that creates a lot of anxiety for many people. We have more distance to go, but we will see our way through this phase of our storm as well. Friday is, as I mentioned, our 2nd year anniversary of the first case in our first briefing, and as I said this past Friday, Omicron has changed and forced us to respond differently, and this is a transition. But I do believe we will have a gentler summer, that we will get to a place where we no longer need many of the measures and restrictions we have in place right now. We will also need to continue to support our healthcare workers and our health system and our hospitals. That is where the strain is being felt the most. And prepare us for our living with COVID in the future in a different way, in a way that doesn't have that dramatic effects on our lives. So I want to sum up today by saying thank you. Thank you, everybody, for being patient with each other, for getting through this, for doing the things that we need to do, and being kind and being calm and being safe. Thank you.
Over to Minister Dix.
Thank you very much, Dr. Henry. Today I'll be providing an update on rapid test inventory and distribution, as well as the impact of COVID-19, the Omicron variant of concern on healthcare workers in our healthcare system, and surgical postponements. First, I want to touch briefly on our immunization efforts, which have been extraordinary, more than 350,000 doses administered in the last week, 110,000 of those in pharmacies. Vaccinations for children aged 5 to 11 continue, as Dr. Henry has spoken. There is lots of available capacity. More than 175,968 children have now had their dose 1 immunization against COVID-19. But that number can be higher. We encourage everybody to register today at the Get Vaccinated website and at 1-833-838-2323 if you want to call in. I'd also note that invitations for dose 2 for 5 to 11 began as of yesterday, with around 2,000 invitations already sent out. More than 27,500 dose 2 invitations for children 5 to 11 are being sent out this week based on an 8-week interval. And the booster campaign as well continues full steam ahead. It was, in fact, not just 350,000 doses, but 350,000 boosters in the last week, and we project similar numbers this week. But I want to say this. There are 644,000 people who've been invited for their booster in BC and have not yet booked an appointment. We strongly encourage them to book into our clinics or pharmacies. There's lots of capacity. And I want to say of special note, there has been an extraordinary take-up of immunization. And if you saw Dr. Henry's presentation on Friday, you know the risk to those over the age of 70 from COVID-19 continues to be high. There are 48,000 70-plus individuals who have received their invite but have not yet booked a booster. It is urgent for them to get vaccinated, as they are much, much more likely to be hospitalized if they acquire COVID-19. And we encourage them to do that, as well as encourage everybody who has not received their dose 1 and dose 2 immunizations to get them today. With respect to rapid tests to date, BC has received 6,931,175 rapid tests and deployed 4,130,656 of these tests to key strategic areas. This leaves an inventory of 2,800,000 tests, 972,355 of which were received over the last 4 days. About 558,000 of the current inventory are not suitable for deployment for takeaway or personal use. That leaves us 2,242,000 tests in our current inventory that are suitable for self-administered use, and we know that 319,860 tests are in transit and expected to arrive in BC in the days ahead. This week, subject to timely delivery from the federal government, we will be working to deliver over 2,500,000 test kits as follows: 351,000 for repackaging and distribution to COVID test sites across BC to replenish their supply, 603,750 to replenish supplies at acute care centres for symptomatic healthcare workers and health authority programs, for example, emergency departments, 210,000 to long-term care to replenish and continue to support symptomatic staff and to test visitors, 50,000 to assisted living to support symptomatic staff and to test visitors, 258,750 to support rural, remote, and Indigenous communities, 300,000 more test kits to support K-12 education, 311,000 to support businesses and organizations as part of the point-of-care screening program. As more tests arrive, we will continue to push the areas in greatest need and expand access across post-secondary and other areas, as identified in the plan we presented on December 21st, 2021. Earlier today, the BC CDC announced it will be distributing rapid test kits to post-secondary institutions for employees and students with COVID-19 symptoms. We are also allocating over 250,000 rapid tests for the childcare sector and are working with the Ministry of Children and Family Development to consider best use and delivery of tests to licensed childcare operators across BC for testing of symptomatic staff and to support continuity of their operations. We will have more to say about this as our supply from Canada is clarified in the week ahead. The expected deliveries from our federal partners have changed somewhat since last week. Currently, BC expects to receive 10,868,720 tests between today, January 25th, and the middle of February. This is a reduction from the 15,719,000 that we were expecting as of last Friday. With that said, 10 million is a lot of tests, and we're very appreciative to receive them. Clearly, the supply of tests will be substantial, but there is continuing to be flux in orders and deliveries as they get firmed up by the federal government. It's also worth noting that we have delivered over 370,000 rapid tests to long-term care facilities across BC since late December, I should say. These facilities have a direct line to their health authority if more tests are needed, and we are replenishing supply to long-term care facilities as tests arrive in BC. In fact, 210,000 more tests are going to long-term care facilities this week. Once delivered, that's over 580,000 tests provided directly to long-term care facilities since late December. And these tests are in addition to tests available to medical health officers if they choose to use rapid tests to help manage cases, clusters, or outbreaks. I'd now like to take the opportunity to provide an update on the impact of sickness on healthcare workers in our healthcare system. First, to acknowledge the exceptional work under very difficult circumstances of all of our healthcare workers in every community across BC in serving British Columbians in a challenging time. Health authorities have been closely monitoring sickness levels across health services, especially in hospitals, long-term care, and home support. I can report that from January 17th to 23rd, at least 17,954 workers called in sick, almost precisely a similar number as to last week. This includes 4,252 in Fraser Health, 3,265 in Interior Health, 1,589 in Northern Health, 1,840 in the Provincial Health Services Authority, that includes BC Emergency Health Services, 2,836 in Vancouver Coastal, 3,359 in Island Health, and 813 in Providence Healthcare. This is the number of healthcare workers affected and does not reflect the number of days or shifts they may have called in sick. Illness could be due to COVID-19 or something else. The number of healthcare workers is relatively unchanged from last week and down from the week of January 3rd to 9th. And finally now, our weekly surgical renewal update. Health authorities reported in the period January 16th to January 22nd that they had postponed 790 non-urgent scheduled surgeries. That's 71 in Fraser Health, 17 in Vancouver Coastal Health, 401 in Interior Health, 275 in Island Health, and 26 in the Provincial Health Services Authority. No surgeries were postponed in the Northern Health Authority. Cumulatively, from September 5th, 2021 to today, to January 22nd, I should say, regional surges of COVID and factors including severe weather patterns have caused 5,894 surgical postponements. As noted, and we've seen this, it's compared to the postponements in the first wave in April and in May of 2020. At that time, there were significantly more surgeries postponed. We are, of course, wanting to postpone as few as surgeries as possible. At that time, we dropped down, I think, 1 week under 3,000 surgeries, which is a very low number when you consider that we do a pace of about 7,000 a week. We continue to do a significant number of surgeries of all kinds across BC. But it is a significant challenge, and the reason why we announced this before Christmas and we're engaging in these plans is to support our healthcare system and make sure that it's there for everybody when they need it most urgently. Every day now, I'd say more and more British Columbians are getting vaccinated. And whether it's our first dose, our second, our third, or our booster, it is an essential commitment we make to stopping the rapid spread of COVID-19, that critical action we take that makes the vital difference to where we stand in our BC pandemic today and where we can go from here. Our efforts, all of our efforts together, slow the rapid spread. We've proven this. Our efforts, all of our efforts together result in surgeries being rebooked. We've proven this again and again. Our efforts and all of our efforts will get us through. We know this. As Dr. Henry has said on Friday, at our briefing on Friday, it will be 2 years since the first briefing, since the first case, and the first briefing that was held in Vancouver, as you recall, at the BC CDC. It has been a long and difficult time for everybody. When I would agree with absolutely everyone who wishes it were over and over soon. But these are the steps we can do now, all of us together, our way to control our situation, follow public health orders and guidance, get vaccinated, and support one another and continue to support our healthcare system in difficult times. And with that, we're happy to take your questions.